Good morning and welcome to the 10th Annual National Workers' Compensation Summit. It's been very interesting presenters with each of the sessions that we've been, and we're getting some really good feedback from the participants. I think the highlights really have, for me personally, the synergies that we are seeing between private enterprise from the employer's perspective, from the national and the international perspective, and the fact that we're seeing that there are so many commonalities across all of those areas, and everybody is starting to appreciate that one problem for them is the same problem for somebody else, but there's some really interesting ways of viewing those new ways of looking at a particular problem.
And lunchtime sporting activities. I can tell you back in the early...
Occupational health and wellbeing programs are important because they're broader than the traditional focus on health and safety, and what it does, it integrates aspects of working life and culture and recognises that a boundary does not exist between work-related and non-work-related risks.
We are having a macro view on workers' compensation systems worldwide, and we identified 9 emerging risks, 9 risks for the future. And just to name 2 of them, we identified obesity and the old aging workforce. The most important issue in respect of obese people is the return to work. So the absence from the workplace is definitely statistically proven higher than for non-obese people. The old aging workforce is of course having an impact on the whole society independently of workers' compensation, and the return to work programs, they are different. They might create higher costs in respect of the old aging workforce, yeah.
Work in these types of environments.
Enforcement of prosecution.
Rehabilitation process. We're just talking about the hip replacement.
It's quite interesting. As the healthcare needs of Australian workers change over time, you actually find the similarities between the objectives of private health insurance and workers' comp come together. And what we're finding is that workers' comp, obviously working in the workplace environment, has a lot to offer private health insurers who are looking to make their members much more healthier in that workplace.
It's been excellent. We've had a really good experience. It's been well organised. We've gotten the branding that we wanted from this and all the access to delegates. We've worked closely with you throughout the process. So now we're very happy with the experience.
Oh, it's been really great. We found I've got some new ideas for our work and some confirmation that what we're doing is right. And the networking opportunities, I've met heaps of new people and new friends along the way too.
Very interesting, because I've come from the other perspective, from the federal government. It's really interesting to see how both schemes work and how people actually get help through the schemes.
This is my first time here and I've really enjoyed it so far to date. Met some interesting people and some really good sessions. Bill Nevin's session this afternoon was, I think, most valuable for me. Really fits into our risk management approach that we're taking in our organisation to really simplify this whole process of workers' compensation so that we can speak the language of management, and I think that'll be really beneficial going forward.